This episode of Distraction is sponsored by OmegaBrite CBD, formulated by OmegaBrite Wellness, creators of the #1 omega-3 supplements for the past 20 years. OmegaBrite CBD, safe, third-party tested, and it works. Shop online at OmegaBriteWellness.com. And by Landmark College, offering comprehensive support for students with ADHD and other learning differences. Learn more at lcdistraction.org. Landmark College, the college of choice for students who learn differently.
That is exactly why I love treating ADHD, is because you can be so successful as a treatment provider because treatments work really well and you really hand people their lives, and it's really nice. People think, oh, ADHD, it's kind of fluffy, it's not, whatever. But my goodness, I can make a huge difference in people's lives from childhood to adult, and gosh, that's a wonderful thing.
Hello, this is Dr. Ned Hallowell, and welcome to Distraction. Today we have a very special guest from the other side of the country, from California, a pediatric neurologist, a Princeton graduate, a UCLA Medical School graduate, and a fan of and expert on ADHD. It's not common to find a pediatric neurologist who specializes in this. And not only specializes, but has written a couple of books about it. ADHD and the Focused Mind, and Winning with ADHD. This wonderful woman's name is Dr. Sarah Cheyette. She is a brilliant woman and a wonderful woman to have on Distraction. Hello, Dr. Cheyette.
Thank you so much for that wonderful introduction, Ned, and thanks for having me on the show. I'm delighted to be here.
Well, it's terrific to have you. Just mention your website is sarahcheyette.com, sarahcheyette.com. I have to prove to our listeners that I can actually read without reversing letters. So how did you get into this field, Dr. Cheyette?
That's an interesting question because, as you said, there's not that many pediatric neurologists who like to treat ADHD, but as I was taking histories on my patients with headaches, I would find that they might have the headaches because of difficulty concentrating, or anxiety. I would find they would have anxiety because of difficulty concentrating. ADHD affects so many things that it's not hard to find it when you're dealing with neurology.
And when did you learn about it during your fellowship? When did you learn about it?
Well, actually not much during my fellowship because, as you know, with medical training, a lot of that is inpatient. So a lot of the outpatient stuff became something that I learned in private practice, and also from mentors such as yourself, and from books and from conferences and all the ways we learn things all our lives.
And do you have a personal interest? Do you have it yourself, or any of your children have it?
No, I don't have any children who have been diagnosed with ADHD, although certainly many of their teachers might have had an argument with me here or there about that with two of them. But I have 4 kids, and I certainly know how a distracted child looks, but nobody has had a diagnosis of ADHD.
So what would you like to tell our listeners about ADHD?
Well, what I think the important thing about ADHD is that it's not doesn't always have to be a negative. It's certainly a negative in some situations, but we all have our positives and negatives. And, ADHD is a wonderful thing at times, but it can be difficult at times. That's nothing that your readers don't, or that your listeners don't already know, but it certainly bears repeating.
Yeah. And what would you say what's the upside of it?
The upside of it, when you learn how to deal with ADHD and meet your challenges there, you can become much stronger there. If you learn how to deal with hard situations, you usually get very good at hard situations. When people come in and get a diagnosis of ADHD, sometimes it's very liberating for them because they say that explains a lot, and it's not just me being bad or my child being bad. but they're sometimes surprised to hear about all the things that they can do. You know, one of my pet peeves is when I hear them say, I can't do X, Y, and Z because of my ADHD. And, you know, that's not a kind of mindset that I like to hear.
What do you think is the biggest undiagnosed group who have ADHD? I'll tell you what I think it is. It's adult women. And you specialize in that, right?
Oh, I definitely deal with a lot of adult women, and some of these are the parents of patients. Their kids had come in to see me, and then they decided that they need to come in and see me too.
Mm-hmm. Yes.
And
yes.
as a mom, you know, when you have ADHD as a mom, it takes an already very distracting situation, and it magnifies that. You know, when you have kids, you know, getting up and going to the bathroom for 2 minutes by yourself without getting interrupted is just, you know, it's a notable event. And the more that people get interrupted, the more their ADHD gets exacerbated. But especially with women, you know, women feel like they have to do everything for all people all the time. That's, you know, obviously a broad generalization, but it's true of a lot of moms that I know. And so they have a hard time prioritizing one thing over the other. You know, a mom is getting constantly pulled in different directions because it's harder for her to say, nope, I'll be with you in a minute. So practicing those words are often pretty helpful. The value of completing something before you move on is absolutely something that needs to be rehearsed with a lot of people. Plus the anxiety piece, I think, is quieter in moms. They wind up, usually by the time they're moms, if they have ADHD, then they feel behind a lot. And even if they don't have kids, even with their jobs and mates and so on, pulling them in different directions, they can develop a lot of anxiety. And the anxiety is this kind of quiet piece of it that is kind of comorbid with the ADHD. Sometimes the anxiety piece gets recognized, but the ADHD piece doesn't get recognized.
Right.
And so sort of like the canary in the coal mine, whenever I talk and the woman feels anxious, you know, we do talk about whether there could be a history of ADHD because that really can contribute to anxiety.
Really cause the anxiety.
Yeah, that's exactly right. And then when you have anxious thinking, it's harder to focus. And then the outcome is worse, and then it makes you more anxious. And
exactly.
So,
and then it makes you depressed because you're not doing as well as you should.
Exactly.
What happens most of the time is the unknowing doctor diagnoses anxiety and depression and puts them on an SSRI, which is not at all what they need.
That's exactly right. And it can take a long time to figure that out, weeks, months, or years. And what these women need is to control the ADHD first, and then the anxiety gets better. But one problem that some, I think, primary care doctors have, and also some patients after they read the side effects, they come back and they say, hey, doc, don't you know that this medicine can cause anxiety? And we talk about the fact that, yes, it can make some people anxious, but the idea would be to try it, see if it makes you less anxious, and then hope it does.
Right. No, exactly. And it's in and out of your system in a matter of hours.
Yeah.
So if it should happen to make you more anxious, you only have to put up with it for a matter of hours. In my experience, it's at least 9 out of 10 people feel better with it, not more anxious.
I agree. That's my experience, too. And, you know, if you read the side effects to coffee, it will also say it can cause anxiety, but people leap ahead for that.
Sure. I mean, the whole world is caffeinated. Coffee is my medication because the prescription stimulants don't work for me. I have ADHD as well as dyslexia.
There you go. And, you know, sometimes there's comorbid sleep apnea where the coffee helps with that. Or, as you know, the ADHD medications are also used to manage the side effects, the problems with feeling sleepy during the day if you have sleep apnea.
Okay, we're going to pause right here for just a moment. Joining me now is Dr. Carol Locke, the creator and founder of OmegaBrite Wellness. She's extremely fussy about purity and pharmaceutical grade and all the kinds of things you want someone to be fussy about. She's here today for a follow-up conversation about the health benefits of CBD and omega-3. As you know, Carol joined me a few weeks ago in the episode we released called Tools to Help You Stay Calm. Carol, it's great to have you back.
It's great to be here, Ned.
So let's just get right to it. Why is taking omega-3 supplements good for us?
Omega-3s are vital for our bodies. They're vital for our brain, for our eye, as well as for our cardiac health.
And in these days of the pandemic and COVID-19, do omega-3s take on added value and importance?
They do, Ned. During this time, as people are stressed every day, both from the COVID pandemic as well as from being hunkered down, that level of stress becomes chronic, and that creates inflammation in the body. Omega-3s can help lower and create a positive inflammatory balance in the body. So they are very important from that point of view, as well as for cardiac protection and in protecting our mood during this time.
So they're even good for mood.
They're very good for mood, and the research over the years has proven out that omega-3s do promote positive mood. They help prevent and treat depression and reduce anxiety.
Now, how can the average intelligent skeptic, like many of our listeners, be sure that it's worth the money to get a more expensive brand like OmegaBrite versus the least expensive brand out there?
Well, good question. You want, when you buy a supplement, to have it be proven in science and proven in science in human beings. And so OmegaBrite has been proven in clinical studies at major academic centers.
And what dose and what ratios matter here?
Well, the ratio that OmegaBrite that we developed was a high EPA ratio. The dose in the studies that has been shown to be effective is 3 capsules of OmegaBrite a day, up to 6 capsules a day.
Now, EPA doesn't mean Environmental Protection Agency. What is EPA?
EPA is icosapentaenoic acid.
Okay. Switching gears slightly, what are CBDs?
Well, CBD is a cannabinoid. So CBD is the best known one and the best studied.
And who should take them and why?
We all have an endocannabinoid system in our body, which is a self-signaling system that helps maintain our mood, helps maintain homeostasis. It's involved in learning and in memory and in inflammation, as well as many other areas. And so many people benefit, Ned, from taking them for pain. Sleep is another big one. People are having really good benefit reducing anxiety, which right now is particularly important during this time of stress, as well as positive mood, and people are using them as well for depression.
Well, I can tell you personally, and I'm saying this not just because you sponsor our podcast, but because it's the truth. I love your CBD product. I've been taking it for about 6 weeks now. I'm just less reactive, less impatient, less apt to spout off, and it's noticeable. It really is, and I love it. I don't like it if I forget to take it. It doesn't tranquilize me at all, so it doesn't take anything away in terms of energy or alertness. It just takes the edge off of my impatience and reactive ADD nature.
That's fantastic. I think that is a benefit. I think that people report feeling more themselves and less pressure. Your description is really apt. Ned, did you feel it happened right away? How long did it take for that?
Yeah, it happened right away. So,
how do you feel as far as on your ability to focus on tasks or accomplish what you want?
Yeah, no, I've mastered that one. My medication is caffeine, so caffeine is my focus drug, and now CBD and OmegaBrite fatty acids, omega-3s, are my mood medication. One more product that I want to ask you about that you also make. You have a vitamin D supplement that you produce. Why should we all take that?
We have discovered, and new research shows that it's important for fighting respiratory infections. So it's recommended right now to help people ward off any respiratory infections, and hopefully that would include any viruses. And it's also helpful for your immune health overall, as well as your bone health.
Well, thank you so much. We have omega-3 supplements from OmegaBrite. We have CBD and we have vitamin D. And if you want to get more or learn more, go to OmegaBriteWellness.com. And that's intentionally misspelled. OmegaBrite wellness.com. Thank you so much for joining us, Carol, and thank you for sponsoring Distraction.
Thanks so much.
All right, Dr. Sarah Cheyette, tell our listeners how a successful diagnosis and treatment can change, let's say, an adult woman's life for the better.
I love it when people get treated and the treatment works because they feel like they have a new lease on life. They'll go back and say, oh, if I only had this during high school or college or whatever, but it's not very fruitful to go do that. And you can point out that you are who you are today because of all your experiences. When it works, it takes somebody who feels terrible about themselves a lot of times to making them feel good and normal and like they are respectable. And I just love that.
Yeah, that's why I love my job too, where people don't realize what a good news diagnosis this is. Once you get the diagnosis, things are only going to improve.
Exactly, because you can treat the right problems and address the right things. That is exactly why I love treating ADHD, is because you can be so successful as a treatment provider because treatments work really well and you really hand people their lives, and it's really nice. People think, oh, ADHD is kind of fluffy. It's not, whatever. But my goodness, I can make a huge difference in people's lives from childhood to adults. And gosh, that's a wonderful thing. I was really, really surprised how few medical doctors were there at the last ADHD convention in Philadelphia. I mean, I love that there were coaches and psychologists and so on. But this is something that people also go to their medical doctors for all the time. And I don't know if it's because, in recent years we've had an array of new medications, although they're not that new. They mainly have different names and slightly different releases. But, I don't know if people are feeling unconfident about prescribing. Also, as you mentioned, or as we talked about earlier, it's not something people learn about in their training very much. It's something that is an outpatient thing that they may or may not feel comfortable learning on their own. Right.
No, exactly. But meanwhile, there are doctors like you out there, and it's too bad someone has to sort of luck into seeing you because, as we've said, an awful lot of doctors would diagnose depression and anxiety in this hypothetical female patient instead of the underlying ADHD, and then she would never get the treatment that could really change her life.
That's absolutely true.
Okay, we'll get right back to the conversation in just a moment. On the phone with me now is Denise Jaffe, the Director of Online Learning at Landmark College, our wonderful sponsor, and the college of choice for students who learn differently. Denise is here to tell us about Landmark College's dual enrollment program, which offers college-level courses to rising high school juniors, seniors, and gap year students who struggle with learning primarily due to a learning disability such as dyslexia, ADHD, autism, and executive function challenges. Thank you so much for joining me, Denise.
Hello, Dr. Hallowell. Thank you so much for having me. It's a pleasure to talk about our dual enrollment program. We offer a 100% online program for rising high school juniors and seniors. And what I mean by rising is that they are college-bound and interested in taking a college course to see if college is the goal that they want to have. Our courses run everything from introduction to business and communications, computer applications, psychology, sociology, creative writing, personal finance, and math. And we focus on college preparedness and transitions. For example, we want to ensure that they have the academic skills and the executive function skills to go to college. So our courses are set up to provide students who learn differently with more guidance, more handrails in order for them to feel and be successful.
Wonderful. So you give them the support they need and you teach them the skills they need.
We do. Our courses are highly personalized and supported, enabling our students to develop and hone those critical academic skills while they're exploring their interests and earning college credit.
Well, so they get college credit and they're getting skills that they'll need when they get to college, regardless of the subject they're taking.
Exactly.
That's a terrific service. If they want to learn more, where should they go?
They should go to the Landmark website at landmark.edu/dual. We'll take them directly to the dual enrollment program with more information and our application.
Wonderful. And what's the fee for the program?
The fee is $1,000. It's a 14-week semester, 3 college credits. There's a second handrail support called the Course Advisor that is specifically for executive function support. And then our department, because all 3, in addition to the family or the school that they're coming from, support that student towards success.
Boy, it's a bargain. That's a great thing. What a terrific, terrific program. Thank you so much. If you'd like to learn more about online learning at Landmark College, go to lcdistraction.org, lcdistraction.org, or the website that Denise already gave you. Denise Jaffe, thank you so much for giving us this really valuable information. And again, congratulations for the wonderful work you all do at Landmark College.
Thank you so much.
I have a hope that in time, it will catch up to ADHD treatment. You may be able to speak to this, but, maybe, it's only recently we've really been talking a lot about ADHD as a adult diagnosis.
Right.
And probably there was a time when primary care doctors did not treat women very much or men for anxiety or depression. Maybe they referred them onward. Maybe the ADHD diagnosis just has to catch up.
Yeah, well, let's hope it catches up fast. I'm doing my best and you're doing your best. Dr. Sarah Cheyette, her books, ADHD and the Focused Mind, that she wrote with her husband Ben, and Winning with ADHD that she wrote with a younger colleague by the name of Grace Friedman. Wonderful resource. And then Mommy, My Head Hurts, a doctor's guide to your child's headache. So she doesn't just do ADHD. She does full service neurology, doing a great service to the Bay Area and her 4 children and her many patients. It's a real pleasure to meet you, and I feel like we're fellow travelers in a wonderful crusade to bring this good news to as many people as we can.
I feel the same way, absolutely. I should mention also my ADHD and the Focused Mind had one other co-author, Peter Johnson. And do you know who he was, Ned?
No.
He is my kid's karate teacher.
Oh, great. Wonderful.
Yes, so it's really the only book in the entire world that's written by a pediatric neurologist, a psychiatrist, and a karate master.
That's just terrific. That is
where
really
that
terrific.
Came from is that I was watching Pete teach inattentive kids and teach kids with ADHD, and he was so good at coaching them.
Yeah.
Every time a kid got their black belt or brown belt, he would have them write an essay. And they all wrote, almost all to a person wrote, what I learned in the dojo helped me in the rest of my life. So it got me thinking about how the lessons of the athletic mindset and what Pete was trying to teach them in karate applied to help them be more focused in their regular life. And so that's what that book was about.
That's wonderful. Well, thank you again.
All right, bye-bye.
That's our show for today. If you'd like to learn more about Dr. Cheyette or purchase one of her books, which I urge you to do, go to sarahcheyette.com. That's Sarah, Sarah, Cheyette, Cheyette.com. You can find it all there. Of course, Amazon would have her books as well. Please continue to reach out to us with your questions and show ideas. We thrive on your participation. We are a community. We are a connected group. Remember, the best antidote to distraction is connection. We will be releasing another listener question and answer episode soon, so please write to us now and get your question on that show. Email or record a voice memo on your phone and send it to connect@distractionpodcast.com. That's connect@distractionpodcast.com. Again, our tremendous thanks to pediatric neurologist Dr. Sarah Cheyette. And I will close by telling you that Distraction is created by Sounds Great Media. Our producer is the estimable and imaginative Sarah Guertin, and our recording engineer and editor is the delightful and clever Patrick Keogh. The episode of Distraction you just heard was sponsored by OmegaBrite CBD. Formulated by OmegaBrite Wellness, creators of the #1 omega-3 supplements for the past 20 years. OmegaBrite CBD, safe, third-party tested, and it works. Shop online at OmegaBriteWellness.com. That's OmegaBrite wellness.com.